Welcome to your teaching session on changes that occur in pregnancy. So this question is important to be answered by classifying into organ system, and that will also help with your thought process. So you can start off by saying there are several changes that occur in pregnancy. These can be classified according to different organs, starting with the cardiovascular. There was an increase in cardiac output as a result of increase in stroke volume and increase in heart rate. There's a decrease in systemic vascular resistance. This is especially important when giving neuraxial blockade, which is what we normally would do in ladies who are pregnant. There is also an increased risk of aortocaval compression, so it's important to do a left lateral tilt. Moving on to the respiratory system, there's several changes that again occur. There will be increase in mucosal congestion and edema. There will be a bronchodilation as a result of progesterone. There's a decrease in FRCA due to a combination of reduction in FRCA and also increased metabolism. Pregnant patients can quickly desaturate. There'll also be an increase in respiratory rate and minute ventilation. And dead space also increases as a result of bronchodilation. As mentioned already, there's an increase in metabolism, therefore increase in O2 requirement and on O2 consumption. And pregnant ladies often would have respiratory alkalosis as a result of increase in minute ventilation. Now let's look at the renal system. There's going to be an increase in renal blood flow and therefore an increase in GFR, so glomerular filtration rate. There's an increase in glycosuria and also proteinuria. But if proteinuria is present in the urine, we should always consider preeclampsia. Looking at the central nervous system, which is very important for us anaesthetists, there will be a decrease in MAC in pregnant patients, therefore we need to use less anaesthetic. They also would have a faster inhalational induction due to increase in minute ventilation and also reduction in FRC. There will be also reduction in the epidural space, and this is due to engorgement of the venous plexus due to the increase in the abdominal pressure. This will also mean the CSF volume is also reduced, so we need to use a reduced dose when giving spinal in patients who are pregnant. There are other changes that occur, such as in the endocrine system. There will be an increase in your thyroxine hormone and also your T3 hormone. In the gastrointestinal system, there'll be an increase in abdominal pressure and a reduction in your barrier pressure. There'll also be a decrease in gastric emptying, further increasing the risk of aspiration in pregnant patients. Looking at the hematological system, there'll be an increase in plasma volume, increase in red blood cell mass, reduction in platelets, reduction in albumin, and decrease in plasma oncotic pressure. Pregnant ladies are also hypercoagulable, so they are increased risk of having thromboembolism, which need to be carefully assessed when looking after these patients. This is a quick overview of changes that occur in pregnancy. There are some more details for each system, so please have a read of that. But I hope this has covered and given you a brief overview of the important changes. Thank you very much for listening.